My name is Joe Balagtas. I'm a professor of agricultural economics and the director of the Center for Food Demand Analysis and Sustainability at Purdue University. So since January of 2022, for the last 25 months, every month, the Center for Food Demand has conducted a national survey to track consumer preferences and behavior related to food. In January, we set out to gauge Americans' food-related New Year's resolutions. Many of us start the year determined to improve our lives, eat better, go to the gym, spend less time scrolling on our phones. So our top-line results, about 1 in 4 Americans tell us they have some New Year's resolution related to food and nutrition. About 80% of those consumers tell us they're trying to improve their health and in particular lose weight. And they have pretty sound plans for losing weight. They're pretty smart about how they're going to lose weight. They tell us they're going to reduce consumption of processed foods, reduce consumption of carbohydrates, reduce consumption of fats and salts. So what does that mean for particular food groups? Consumers plan to reduce consumption of candy and desserts and also reduce consumption of salty snacks. And they plan to increase consumption of fresh fruits and vegetables, as well as lean proteins, in particular plant-based proteins like lentils and also fish. We also asked survey respondents to grade their diets on a scale from poor to excellent. 84% of Americans give themselves a grade of good, very good, or excellent, which is good news. However, based on careful measure of what Americans actually eat, professional nutritionists give Americans' diet a failing grade. So there seems to be a little bit of grade inflation how we evaluate our own diets. My colleague here at Purdue and collaborator in this project, Dr. Heather Eicher-Miller from the Department of Nutrition Science, puts it nicely. She says, we appear to be a little bit overly optimistic about how we're doing at the dinner table.